Have you ever looked at an official report about a place and thought to yourself, wait a minute, that doesn't sound like the place I know? Well, that's exactly what we're going to dig into today. We're looking at Shasta County, California, where the story on paper seems to be a world away from the story people are living every single day.
So it really brings up a fundamental question, right? How should we actually measure success for a place like a county? Is it all about the bottom line, the balanced budgets, and all the neat and tidy paperwork? Or is it about something, well, more human? The actual well-being of the people who live there. Let's keep that in mind as we explore these two very different stories.
Okay, so first up, let's look at the official story. This is Shasta County, as it's presented in its own documents. It's a world of financial reports, administrative plans, basically the county on paper.
And this is the face of that official story, the county seal. It's a symbol that's meant to project order, stability, a system that just works. On paper, it's a picture of a government that has its act together.
Now, right out of the gate, from their own financial report, we get a really clear idea of their philosophy. They talk about containing costs and conservative spending. And notice what they single out: public safety and social services. This is a big clue into their official strategy. It's all about fiscal prudence.
And this is what that philosophy looks like in practice. It's documents like this one, a Certificate of Cost Allocation Plan. You don't need to know what that is exactly. The point is, it's designed to show that everything is orderly, compliant, and managed down to the last detail. It's all about looking good on paper.
Okay, so with that focus on conservative spending, what do the social programs actually look like? Let's check out the services that the county says it has in place to help its most vulnerable people.
A perfect example is this: the Crisis Residential and Recovery Center, or CRRC. The idea here is that it's a safety net. It's supposed to help adults who are going through a mental health crisis so they don't end up in the hospital. It sounds like a really critical piece of the support system.
And when you look at what they say they offer, wow, it seems incredibly thorough. Daily groups, coping skills, medication help, peer support, the list goes on. The picture they're painting is of a really robust, all-encompassing program. Total support, right?
And it's not just the CRCC. Officially, there's a whole network. There's the STAR program, which is this intensive, whatever-it-takes model. There's the Woodlands, an apartment complex for folks at risk of homelessness. And there's a whole suicide prevention initiative. The official story is that they have this interlocking system of care, a real safety net.
But right in the middle of all these official plans and programs, we find something that just doesn't add up. A number. A single, really disturbing number from the county's own reports that starts to poke a hole in this whole story.
And that's where we have to pause and ask, if this system looks so great on paper, is it actually working in the real world?
Well, take a look at this. This number is from the county's own data. In Shasta County, the rate of children entering out-of-home care, we're talking foster care, is 6.1 per thousand. The state average for California is 2.8. That is more than double. So despite all those programs, the county's most vulnerable kids are being taken from their homes at a truly shocking rate. This isn't just a crack in the official story. This is a chasm.
And that brings us to the second story. So let's just set aside the official reports for a minute and listen to the people who actually live there. These are comments from a recent community survey. This is the view from the ground up.
And what you hear is just raw. The frustration is palpable. When people were asked about the county's problems, homelessness was mentioned over and over. This person captures that feeling perfectly. A crisis that's not only visible everywhere but feels totally ignored by the people in charge.
And remember, all those mental health services we just saw on paper? Well, this comment tells a completely different story. This resident says the community is absolutely poor in resources and the people are suffering because of it. That's a huge disconnect.
And here is where those two realities just collide head-on. On the left, you have the official brochure version of the Crisis Center's services. On the right, you have a resident's real-world experience. A quick, here's a med, and a 20-minute appointment. The gap between what's promised and what's delivered feels massive. And get this, the feeling of being unsupported apparently extends to the county's own employees. Just think about the irony here. The very people who are supposed to be helping the community are apparently paid so little that they need social support like food stamps themselves. It's unbelievable.
So, for a lot of residents, this isn't just about services failing. It's about a failure in leadership. Comments like this one show a really deep distrust of the county's elected officials. It's more than just a breakdown in programs. It feels like a breakdown of trust between the government and the people.
So what do we do with this? We have two completely different stories about the same exact place. Let's put them side by side and see just how far apart they are.
I mean, the contrast is just incredible. The official story is all about being fiscally responsible, having robust programs, a real system of support. But the residents' story, it's about feeling neglected, watching services fail, and completely distrusting leadership. These aren't just slightly different points of view, it's like they're describing two different planets.
And that's the heart of it, isn't it? You have a government presenting this picture of careful management and great programs, and then you have the public who feels unsafe, unsupported, and completely unheard. Which leaves us with a really tough final question. When the official reports say one thing, and the lived experience of the people says something else entirely, which one is the reality? Which story is the real story of Shasta County?